Nordoff Robbins music therapists work with people of all ages and all kinds of life situations. So we work with, really little toddlers with their parents. We work with children with developmental delay and autism and emotional behavioural difficulties. We work with people who've had sort of head injuries and strokes, people who have cancer. Lots of places we work with people with mental health difficulties. And increasingly there's work with people with dementia as well in care homes. And we employ people to do this work, but we also train musicians to become music therapists and to work in this very particular music-centered approach to music therapy. Most of the work we do in partnership with other organisations. So our music therapists will spend a day a week in a school or a hospital or a care home or a neuro rehab unit or something like that. And they'll be there each week. And so they'll work in a regular kind of way with the people there. And the advantage of that is that, we can do individual sessions with people, but we can also do groups and we can work quite broadly with the institutional setting. So we can be really flexible in the way we work. And in a lot of places where we work, that's really important. So to take, community mental health as an example, it's about drawing people in and making them feel connected and purposeful and like this place has something alive in it. So music therapy can do that and work with individual people who particularly need it at that time. And then we also have some buildings around the country that we use. So we're sat in the biggest of them now, which is our London centre. And as well as being like the headquarters of the charity, there are rooms here which are for people to come and have music therapy. And it's very busy on Saturday with parents bringing their children, but it's not just for children. Anyone can self-refer themselves. People do get referred sometimes by social workers or schools or doctors, but actually people are welcome just to walk in and request music therapy. And there's no charge for it because that's paid for by the charity. And then between that, we've started a new kind of way of delivering, which we are hoping will make music therapy services more available to the people who perhaps would benefit most but find it hardest to access them. So, it's all very well having a centre, but if people can't get here or if they don't have childcare, it's very difficult to do it. So we're working with some of our partner organisations to offer free services from their buildings as well now, which is making it much more available to people in more places and targeting particular groups of people who find it hard to access service otherwise. So we're working with some refugee organisations, for example, to try and make music making as available as possible to that population. I think as a music therapist, the key thing is to be able to have a go. You need musicianship. So you need kind of a musical imagination. So if you're working with someone who's quite restricted in some ways, you need to be able to imagine how they might be able to be musically. You don't have to be like a concert pianist. You don't need to be Eric Clapton on the guitar or anything, but you do need to have resources that you can kind of use in a strategic way to help people, to make a difference to people.